Myotonic dystrophy, MD, is a long-lasting illness that mainly hurts the muscles. It makes them weak and slow to relax after a squeeze. Think of a rubber band that stretches easily but does not snap back quickly. MD also can affect the eyes, heart, and other parts of the body, and it can get worse over many years. MD is caused by tiny errors in our DNA. In the most common form type 1, a piece of the DMPK gene repeats too many times. In type 2, a similar repeat happens in the CNBP gene. These repeats are passed from parent to child in an autosomal dominant way, which means just one copy of the faulty gene can cause the disease. Typical signs are muscle weakness, for example, having trouble lifting a grocery bag. Myotonia, muscles stay tight after a quick move, like when you try to open a bottle cap and the fingers stay stiff for a few seconds. Early cataracts, cloudy eyes, heart rhythm problems, and feeling very tired. Children may have learning or speech difficulties, while adults notice more trouble climbing stairs. Doctors find MD by 1. Asking about family history and checking the symptoms. 2. Doing a blood test to look for the repeat DNA pattern. 3. Performing an EMG test that records the slow relax down of muscles. There is no cure, but treatment helps the symptoms, physical therapy to keep muscles moving, medicines such as Mexaltine to reduce myotonia, regular heart checkups, and cataract surgery if needed. Because MD comes from inherited DNA changes, we cannot stop it from happening in a family that already carries the gene. What we can do is use genetic counseling. A doctor can explain the chances of passing the disease to children, offer carrier testing for relatives, and discuss options like prenatal testing or in vitro fertilization with pre-implantation genetic diagnosis. New research is looking at ways to silence the bad gene copy. Scientists are testing antisense oligonucleotides, tiny pieces of DNA that attach to the extra repeats and tell the cell to ignore them. Early trials show they may lower myotonia and improve muscle strength. Other studies are exploring CRISPR gene editing and small molecule drugs that clean up the abnormal RNA produced by the repeats. These approaches are still experimental, but give hope for future treatments.